Asbestos is a naturally occurring element. It's a rock, and it's been mined and used in Australia extensively over the last 50 or 60 years. We particularly have this issue in the ACT, which is quite specific to the ACT and some in surrounding New South Wales regions, of the loose fill asbestos. And that's what the whole buyback program is about. So asbestos is dangerous. There are no safe levels of asbestos, but there is a commonly held belief that every fibre of asbestos will kill you. Now that is not true, and we have good evidence now from multiple studies around the world that the more asbestos that you're exposed to, the more likely you are to get a problem. But it's really quite massive doses over a prolonged period which have been most associated with the more severe effects, such as mesothelioma. Yeah. So in terms of the loose fill asbestos, if people have been living in a house for a long period and the house was poorly maintained, they would have a relatively higher risk, but still extremely low. People that are living in a house with Mr. Fluffy asbestos, which is well maintained and have evidence that there are no fibres in the living areas, would have an extremely low risk of developing asbestos-related disease. People that have intermittently visited briefly, even lower. So it's that scale which is very important to understand, that it's large exposure to large amounts of fibres of asbestos for a prolonged period of time is dangerous. But that danger decreases rapidly as the exposure becomes shorter or less fibres being exposed to. The risk is low even for the people that have been living in the Mr. Fluffy houses. We realise though that it's not zero. And as houses deteriorate over years, then that risk can increase. And so the government has made that decision based on a range of reasons, but including looking at a precautionary approach into the future. And really the best solution we've come up with is to remove this problem once and for all, and that's why we've gone down that line. It's important for the community to understand that asbestos is a naturally occurring element, and it is around us in many ways. It has been used for many years in the construction industry, for example. It was previously used for brake pads. It's been used as a fire retardant material in multiple ways in various occupations, and particularly in defence. So it's all around us. And in the urban environment, all of us are exposed to asbestos in one way or another in small amounts. Having said that, it is small amounts, and so people need to understand that really it is what we know about asbestos exposure and disease is based really on very large exposures over a prolonged period of time. So whilst we want to avoid exposure to asbestos as much as we can, the risks are extremely low actually in the ACT. If people are worried about their level of exposure, they should see their local doctor. And I'd say there that people may be worried in other reasons around the whole Mr. Fluffy episode. Neighbours and so forth are going through a time of transition, particularly people that have been leaving their houses and are currently leaving their houses. As the demolitions go forward, that will be another time where it's quite reasonable and expected that people will feel anxious, upset, even depressed, and more serious mental distress. And so I really encourage people to see their GP. And the ACT government has put in place with the ACT and Medicare Local a range of extra supports for psychological distress at this time. And so there certainly is there, and I would encourage people to take advantage of that. So for people that are concerned about their exposure, and I would say that that's really people that have been living in Mr. Fluffy houses, or people that have been working on Mr. Fluffy houses, they're the ones at most at risk, not really the neighbours, not really people that have just been visiting from time to time. But anyone who's concerned about that risk can go to their GP and discuss their individual circumstances. It's relatively easy for me to talk about the general issues in the ACT. I know the rates of mesothelioma, they remain extremely low, but individual circumstances can vary, and I would encourage people to seek advice from their trusted medical advisor, normally their general practitioner. I'm very confident, looking at what has been planned, that there will be very little asbestos that will leave the site of the demolition. Asbestos is a rock. It doesn't actually fly around very easily. It is not dust. And so even if there was asbestos fibres there, it usually settles very quickly and very locally. So the chances of those asbestos fibres going outside of the property of the demolition is extremely low. The issue with the one fibre is an interesting one. So certainly asbestos is not there is no level of asbestos which is completely safe. But really it's the larger exposure to asbestos, many hundreds or millions of fibres, is really the issue here. So everyone will breathe in asbestos during their lifetime. Anyone in an urban setting in Australia will breathe in asbestos in their lifetime. Every hour, all of us are breathing in some asbestos in our lifetime. And yet in the ACT, less than 10 people will develop mesothelioma this year. So it just doesn't make sense to me that one fibre will definitely kill you when all of us have more than one fibre and very few of us are getting that disease. I think the most important thing to understand now is that there's two things that are going to happen around the time of the demolition. I think firstly, the people who are leaving their houses are going to be upset about that, and I can really understand that people who have long associations with the houses where the kids have grown up and so forth, this will be a worrying time, and that's quite reasonable for people to feel psychological distress at that time, anxiety, not being able to sleep, even depression. And so I would really encourage people that have been closely involved now or in the past with Mr. Fluffy Houses, just if they're feeling those things, to recognise them in their own self, and to take advice from a trusted medical practitioner. And the ACT government has put in many supports there in terms of mental health support and psychological support, which are accessible and free. So that would be one group. The other thing to say would be that we really have the very best way of dealing with this problem in terms of the demolitions. The chances that any asbestos fibres will leave the actual properties is extremely low, and even if it did, the chances that would lead to any illness in neighbours through this whole process, either the demolitions themselves or the transporting of that material to its final destination, is extremely low, and I would really encourage people not to be worried about that. So the ACT government will be releasing the list of the Mr. Fluffy Houses soon. And this may raise anxiety for people who suddenly realise for the first time that they've actually been associated with the houses, either having lived there, having visited there, or for tradespeople they may have worked on these houses unknowingly. That's a time when people should take note of their own health, and they could seek advice from their own GP about their particular circumstances. Again, for people that have had only minor exposure to the houses, we feel that the risk of people having an asbestos-related disease from those sort of exposures, infrequent visiting, for example, is extremely low. For the tradespeople, I would hope that they've used the usual precautionary measures, but if they're worried, they should go through the usual process. For the previous occupants, then they definitely should consider about how long they've stayed there and what sort of risk they may have been in, and seek medical advice for that.